We have a special one today. I mean, they're all special, but this one's going to be flippin' amazing. Who is just incredible. So here we go. Can't wait. Hi, guys. Hi. This is a subject that we feel like we keep hearing about, particularly ketamine therapy, Ayurvedic medicine, integrative medicine, and it just continues to come up. So we are going to get enlightened by the one and only Dr. Gillian Ehrlich. Let's see if she's there. I'll ask her to join again. Invite. She's been invited, people.
Oh, no, not
Oh, hey!
wrong person. Jillian's supposed to be answering. Hold on.
Oh, it's okay, wrong person. We still love you.
I'm Shannon. I'm the director.
Hi,
I was just, my
Shannon.
phone was blowing up and I thought she needed me to log it in. Hold on.
Do you want me to invite back?
Yeah, for Jillian, let me message her and tell her she needs to respond.
Okay, perfect. Go ahead.
Thanks.
This is always the fun part. Bananas. Drum roll, please. By the way, we're going to put all of the information for Neuroveda Health, which is the amazing practice that Dr. Ehrlich has founded up in Seattle, Washington.
Hi.
Oh, hi.
My God, I had a little technical difficulty. I'm so sorry.
Here's the thing. I feel like every time my mom goes from her cell phone to Bluetooth in her car, it's like a miracle, you know? And I feel like the same happens every time I do an IG Live. You know, it's like a small miracle.
It is a small
in the metaverse.
I know. Gen Xer, and so I'm like, is this little box gonna do its like thing?
Is it real? And it is. It is real.
Yeah.
Well, we're so glad to have you. I mean, not in real life. I wish we were in real life together, but that's okay. Be really fun.
These days.
This is going to be a good one, and I've been jonesing for this conversation since the last time we spoke.
Excellent.
And I cannot wait to introduce you to our audience. And there are a lot of people joining. This is so awesome. I think it was my title. I think it was the ketamine therapy.
Oh, yeah. I know. People,
It's fascinating. And so if you don't mind, can I dive right into your bio? And you're going to have to fill in because you're so ridiculous that you can say, oh, Melissa, I also have this degree. Because your name ends and then there are about 17 acronyms for your degrees.
Yeah.
Anyway, so we are joined today by the incredible Dr. Gillian Ehrlich, who is the founder of Neuroveda Health up in Seattle, Washington. Dr. Ehrlich has been studying Ayurvedic medicine for 25 years. No. Oh, yes. And functional medicine for 15. Is that correct?
Yep.
Okay. Vice versa. She has taken all of these, and you saw it in the title, Ayurvedic medicine, ketamine therapy, integrative medicine, and created this practice that looks at our bodies holistically and these approaches and therapies in unison. And so I'm going to just say this because it's so fascinating. You've integrated functional medicine, Ayurveda, modern neuroimmunoendocrinology, and mitochondrial medicine to address the complex health changes and optimize longevity. So we're just going to pause there. That's a lot, but I think at the end of the day, what you're saying is there are all of these different approaches to extremely complex things that are happening to our body that doesn't just address symptoms, but rather source, and then leads to overall better health, less chronic issue to support longevity.
Yeah.
Okay. Awesome.
Got it. You're on it.
You have a doctorate of nursing practice.
Yep.
You have certifications from everywhere, and I can't even list them all because you're one of those friends who's like magna cum everything. Like she has all of the you just won all the prizes. Institute for Functional Medicine. You trained at the Ayurvedic Institute. You trained under incredible mentors for years and years and years. And that is all to say that your approach is vetted, experienced, and really, really thoughtful to how you're coming to the table. And today we're going to talk a lot about midlife and how these treatments and therapies, you're dealing with them in your practice every day with different women. So Did I miss anything? Because you're not normal.
I know I am not. I mean, I will say, so the two other pieces I would add that are my part of my background and really, I think, contribute to my perspective and approach is that one, I've worked a lot with underserved populations through Harborview, both as a nurse on the floors as well as a nurse practitioner in the medical respite. So we had basically a medical shelter for unhoused men and women who needed acute care, but also we offered wraparound care. And so there's that piece that I come with as well. And then I really come from an outdoorsy background. So I was an Outward Bound instructor for 6 years. I did a lot of outdoor work. And so nature's always like my happy place. And, you know, nature holds a lot of magic for us, for our nervous system, for our immune system, for our endocrine system, for our GI tract. You know, nature pretty much tells us everything we need to know. So we can talk more about that too, but I would say that's kind of the mix.
I love that. It's, you know, the concentric circles of, well, and nature holds so many truths that come through. And I think in a lot of the practices that you have, and as well, you do Chinese medicine within your clinic, which, you know, we've talked a lot with different Chinese medicine practitioners and acupuncturists, et cetera. And there's, you know, they'll say thousands and thousands of years and nobody knows how, but it just is, which is pretty incredible. So can we start at the beginning and understand why, after all of this rich background of your life of serving the people that you've served, that you ended up founding Neuroveda Health?
Yeah. So Neuroveda, my dream from when I left the Ayurvedic Institute in 2001 was essentially to be a nurse practitioner in an insurance-based system, because I did not want it. When I learned Ayurveda, I thought, okay, I could be a lifestyle coach. I mean, and that wasn't really a thing back in 2001. People weren't really doing that as much as they are now. And so it wasn't accepted. And I thought, oh, I'm just going to have to, it was going to be a big fight to kind of be accepted. And I knew that it was going to be hard to get folks interested and acquainted with Ayurveda for their own health if I didn't look like a certain way. And so that's why I was nursing for nurse practitioner. And then I found functional medicine as a way of kind of like a modern expression of a systems approach to health and medicine. But I wanted to look like a regular old family nurse practitioner. And on paper, I am. You know, we are people who work at Providence and Swedish and, you know, Kaiser. And, you know, I'm a nurse practitioner just like everybody else. But I have started with this Ayurvedic approach, and that's really how I treat patients. And so I tried that for a long time. and I could not make it work in the system. I was dying on the vine in there.
Yeah.
I was working a 60-hour work week and getting paid for 30. And I just couldn't. I started Swedish full time with a 9-month-old baby. So I wasn't sleeping at night. I was working 60-hour work weeks. I was trying to, my husband and I were trying to pay for childcare and everything that you have to do. And it was much. And to be honest with you, I spent more time. I was in a little enclave where they put us, another functional medicine provider and I. And so I was doing time-based billing versus complexity-based billing.
Mm-hmm.
And so time-based billing, there's certain charting things that you have to do. So I was doing all of the correct charting things. But by the time I was done at Swedish in the primary care clinic that we were kind of buried in, I had received at least 2 letters from insurance companies, basically showing my metrics next to regular old nurse practitioner metrics. And I built what's called a 99214 or 99215, these kind of, 25 or 40-minute visits. I billed them at a much higher rate than my colleagues. And it was basically not very well veiled threat of, if this continues, we shall be auditing your charts. And because they really don't want practitioners to spend, they don't think there needs to be that much time. But the healing, the thing that I was thinking as you were saying, kind of my bio, was the thing that I learned from Ayurveda is that as a healer, your job is really to enter the heart of the patient and be with that space inside of the chest. And that's kind of what I love. Like when I'm with people, I like to kind of feel what it feels like to be them, listen to them and kind of feel that energy and decide like, okay, what is it that they need? Yeah. What is it that is going to allow them to kind of move and shift? And that's different for everybody. And you can have 2 people with the exact same condition. We have obviously millions and millions of women in menopause. And the piece that's amazing is that as unique an expression of our humanity as we are, menopause is going to look different for everybody as well. There is no one right way to do this. There's no one estradiol that's going to fix it. No one progesterone, no one, cortisol or insulin. We know there are patterns.
Yeah.
We know patterns like cortisol and insulin are actually much more directive than estrogens and progesterones, and for a lot of women in going through perimenopause. Yeah. But what that looks like and what those particular interventions are is going to be unique for every person.
So fascinating. And I think you touched on, as many of us with kids who've navigated corporate America and then ended up in the seats that we're in is out of function.
Yeah.
And our own heart saying, you got to lead the way and you have to make whatever it is, because nobody's going to make it for you. And you end up in this space that feels so much more, gratifying and grounded and, kind of purposeful. So thank you for building what you're building, because so many women are going to be benefiting, and men. I'm sure men too. I'm just, I acknowledge them.
I know.
For what it's worth.
I'm supposed to, treat men as well. I don't treat a lot of men. I treat some men's health problems, but yeah.
So have you addressed this? Your approach with integrative medicine, you're obviously a nurse, but you have this rich background. How does integrative medicine specifically approach perimenopause and menopause? So
again, it's a big field. And so there's lots of different approaches. The way that I was trained by my mentor, Keisha Ewers, who's also a nurse practitioner, an incredible practitioner. The way that I was trained is that we have, the HPA-TG axis. So we've got the hypothalamus, the pituitary, the thyroid, the pancreas, the ovaries. I feel like I'm missing some endocrine glands. Oh, adrenals. Oh, yeah, those
are big.
Those are big. Yes. But so there's this whole endocrine web, and it's affected by everything that's inside of us, our digestion, our microbiome, and as well by our autonomic nervous system, by our immune system, by our perception of safety and threat. And so that when women come to the perimenopausal time, and this is the story that I actually tell women, and I think it's not exactly politically correct, so I just want to say that up front, but if we're starting our cycles at 11, 12, 13, by the time we're 15, we really kind of are physically ready to have babies. And by 30, we're kind of ready to be grandmas. And by 45, we're ready to be great grandmas. And by 60, we're ready to be great great grandmas. And our job should really be just sitting around the fire, bossing people around, holding babies, making food, and being with each other.
Yeah.
And I can't remember where here, but there was a researcher who was really noting that women go through perimenopause. You know, if we say a lifespan is 100 years, women spend half their lives in menopause,
Right.
and there is value. We actually live longer than men. So our value in our culture, in our society, in the perpetuation of our species is not just in our reproductive years, that the wisdom and the connections that we hold after having any babies that are going to be had is really in our wisdom and our connections, and that we really are keepers of stories, and keepers of wisdom, and that we have an important role to play. And so if you think about when the estrogen and progesterone, when those reproductive hormones, when that juiciness might start to decline, it's because we're set. We don't need that amount of like control and rigor over our lives. But that is not what modern life looks like. Speaking as a 50-year-old with a 10-year-old,
Right.
you know, just to like, I am not a great grandma sitting around a fire bossing people around. I am, you know, actively participating in raising a child. And so it's a matter of, if we need that much juice now in life, and we are CEOs, and we are, you know, managing our households, we're managing corporate households, we are managing a lot of men. I shouldn't say that. I do love men. So just, you know, but we're managing a lot of people, and we're managing a lot of things. And so to be able to have enough juice to do that, that's where our adrenals can really tank. And if we've had a lot of trauma in our history, then adrenals often have already been kind of squeezed for decades, potentially decades. And that's where we can really start to go down and that's where we can really end up having perimenopausal symptoms. And so when I think about the perimenopausal time, I think one is, what is the demand on our life? And do we have options that we can make it less? I mean, that's part of that. Can I swear on your?
Yeah, sure can.
So that's where, you know, you give no more fucks, right? That's what people say. And I will be honest that has been my experience in hitting 30, hitting 40, and hitting 50. Yeah. And so far 50 has been the best, like the least fucks. So I'm so pleased to be 50.
Yeah.
But I had a young doctor call me about a very complicated patient a couple weeks ago. And then, you know, and I was just clear with what my perspective was. And here's they're a very sick, they're very, very sick young adult, 23 years old.
Yeah.
And on tube feeds, you know, not able to really tolerate food, not really, you know, very, very sick. Yeah. And this person was very concerned about their pain medication usage, about like all-cause mortality. And I was like, are you serious? Like, yes, that is a thing, but like, look at this person and look at what they need. And afterwards, the patient came back and said, that doctor enjoyed talking to you and did comment on your sass. So just to say, like, you know, as we come further along in the years, we are meant to have almost less draw on us.
Yeah.
We're meant to be more settled, and that is not our reality. So then, as we think about our reality, when we address hormones from when we address perimenopause from the integrative perspective, we are not going to start with just replacement of estrogen and progesterone, or even estrogen, progesterone, and testosterone, or even those and some DHEA or some herbs. We are really going to look at the roots and the foundation of that HPATG, that hypothalamus, thyroid, gonadal, adrenal axis, and look at like, where are our strengths, where are our vulnerabilities, and really address those things first: the mind, the thyroid, and the adrenals, and the blood sugar stabilization. And, you know, when we talk about cortisol is a hormone that comes up in response to acute stress. So it's epinephrine or adrenaline if you're in England, but, you know, epinephrine that can come up first, and then that's followed by cortisol, which kind of does the sustaining of the stress. And cortisol can increase weight gain, and cortisol and insulin, you know, can dysregulate blood sugars. And so as we're in that perimenopausal time, our emphasis really needs to be on blood sugar stabilization, stress management, or life management to decrease stress as much as we can.
Yeah.
And then looking at thyroid and adrenals potentially before we even get to estrogen and progesterone.
I feel like you know, we had a conversation with someone in our community recently, and she was talking about this sudden weight gain. She had done nothing in her life.
Yep.
Hit her like a ton of bricks. And she said it didn't matter what she did. It didn't matter if she exercised more. It didn't matter if she ate less. It didn't matter if she did all the things.
Yeah.
And I think to your point, and so much of it comes out of, then you get this frustration because in your teens and 20s and 30s, you're like, I'm going to lose this. No problem. Like, I got it.
Yes.
And it's different.
Yeah.
And something has changed. And so how do you approach that from a different headspace, but also just understanding, to your point, the different functions of all of these endocrine organs?
Yes. I mean, and weight gain is tricky. You know, I wouldn't say I've totally cracked the nut for every patient. Yeah. I do think it's a combination of that. I think it's really driven by that cortisol piece. And I think that our weight training needs to really shift as we get into perimenopause, mm-hmm. because we a different level of muscle building. And I think that, you know, when you give, it's not like you care less. I really like that approach of like less fucks given, because that's kind of like that piece of like, oh God, are they going to like me? Are they going to accept me? Am I going to be safe? Am I going to run? And it's more about like, you can care more deeply about appropriate things.
Well, and I think that we talk about the toolbox often, right? That you said it, you can go on menopause hormone therapy. Super great. But that is not going to solve. It is one piece of a very complex puzzle. And would love your perspective on how you're looking at, you mentioned mental health and stress. What are some of the tools that you use in integrative medicine to help say, okay, here are some things that you can start to do? I mean,
I have like a whole list. I mean, we could do like an hour of just like listing of mental health tools. And so I would, in order from, I would say probably like least amount of time and effort and money to most, I would say in the home realm, there's always breath work. And there's lots of different kinds of breath work. So we do teach breath work at our clinic, and we teach Ayurvedic breath work. And so that can be something as simple as alternate nostril breathing. That can be as easy as yogic breathing. That can be some like box breathing or 4-7-8 breathing. And that can be as intensive as Vastrika, Kapalabhati, Agnisar, Anulom Viloma, holotropic breath work, Wim Hof. You know, just using the breath can be incredible for both like exhaling toxins as well as oxygenating the body, as well as regulating the autonomic nervous system, the management between the sympathetic fight or flight and the parasympathetic rest and digest. So breath work, I mean, we're all doing it. Yeah. It's kind of talk about Kegels. Everyone does Kegels. And you talk about breath work, everybody's like.
Well, and I feel like I do it with my kids. I'm going to be really honest. I do it with my boys. So I say, okay, let's do some tummy breathing, or do some big breaths, you know, if they get stressed or going to bed. But I don't necessarily apply it. I mean, I should be better, but I certainly do it with them, like in this very thoughtful, because they learned it in preschool. I mean, they learned to do their deep breaths in preschool. I mean, that's how different that generation is. I mean, as opposed to those of us who were feral children in the 80s who were given no breath work. No. And it shows. No. But it's interesting because we were talking to Dr. Juliana Hauser last week with Mental Health Awareness Month, and she brought up box breathing as well as just one of those really fundamental parts of how she, encourages her patients to start that acknowledgement of breath. So.
And I will say that for people who have had a lot of trauma, especially early, one of the reactions is that you actually hold your breath, right? So when you're hiding in the grass and the tiger is pacing, you hold your breath. And so Ayurveda would say that the lungs are actually the home for grief in the body. So I want to recognize for any women out there who are like, I fucking hate breathing. Like I feel terrible. That's not unusual. I get that a lot from patients. And so while we are
fascinating,
has that low access, you know what I mean? Like very easy access. There are people who, when they take a deep breath, it hooks to that trauma. And sometimes you're trying to still suppress that trauma so you can get through your day versus like managing it, dealing with it, discharging it in that moment. So for some people, breathwork can be really challenging and really unpleasurable. Really
fascinating. It's like in Eat, Pray, Love when she couldn't get out of India fast enough.
Yes.
She was like,
yes.
I'm out.
Yes. Yeah. So breathwork And then there are some home things programs that I've had patients do really well with. So the two that I think of are Gupta program.
Okay.
Get online, and one is called DNRS, which is Dynamic Neural Retraining, Restructuring System. I can't remember exactly. It's Annie.
We'll link it in because that would be fascinating.
So DNRS by Annie Hopper. She wrote a book called Wired, and then Gupta program. So those are programs I've had patients read books and be like, and do the practices and have revolutionary change.
That's incredible. Okay. Can we move to revolutionary change? Yeah. And you and I had a conversation around ketamine therapy. Yeah. And I personally have not done it, so I cannot speak to it. But I've had a handful of friends who, in their 40s and 50s, have raised their hand and said, I'm ready now. Yeah. And I would like to do this. Yeah. And would love for you to, number one, just explain what it is. Uh-huh. And then we can go through, why women might want to consider it in this phase of midlife.
Perfect. And so what I'll say, just to kind of link it, there's the breath work, there's the things you can do at home. Then there's that huge bulk of like talk therapy, somatic therapy, reevaluation counseling, like all the internal family systems work, like all of those counseling, all of those things. And then I would say more intensive than that is the psychedelic work. And so there are many different types of psychedelics. A lot of them are plant medicines like ayahuasca or psilocybin. Psilocybin, I know it's legal in Oregon. I think it's legal now in Colorado as well. It's not legal in Washington State, which is why we don't use it in our clinic, but that's the only reason why. And I do recommend, I want to be clear that I do recommend people use these with guidance, like preferably medical oversight or guidance from knowledgeable people, just because things can go wrong, and what is, said to be in a jar or a vial or a baggie or whatever may or may not be that actual thing. So, please do use these things intentionally. Yeah. Ketamine is, the crazy thing about ketamine is that it is not a plant medicine. It was designed in the lab in the 1960s. It was approved by the FDA as an anesthetic in 1970, and it has been in continual use ever since. Like, I always joke that the organization that probably uses the most ketamine in Seattle is probably the Children's Hospital. It is so physiologically safe. It's still part of anesthesia. Within the last 10-ish years, we've recognized a second indication, which is treatment-resistant depression. And there is one FDA-approved formulation for ketamine called Spravato. And there's a lot of limitations on how you use Spravato, nasal spray. And it's, so it's formulated Spravato. You can order ketamine other ways as well. So the ways that we use it in our clinic is you can use it as a nasal spray. You can use it as an oral lozenge. You can use it as an intramuscular, which is what we do of our dives, or you can have it as an IV, which is what most people get as like a ketamine assisted psychotherapy. And so in our clinic, we use magnesium in the IV as well to potentiate it, to help the ketamine. But what I prefer best is actually the intramuscular, because I think I like the cadence of the ride it gives, if that makes sense. So the idea is that when you come to our clinic, we do an intake. So we're going to spend an hour talking with you about your doing a medical clearance, psychiatric clearance, looking at what medication you're on. There are some medications that interact with ketamine, like lamotrigine is the most common one. And so we want to talk about that. We want to talk about preparation. People can get nausea or headaches. And so we want to figure out, do you need pre-medication? You want to fast before a dive so that that nausea. And then people come to our clinic. And when you do a dive, we've already determined the dose, and it is weight-based dosing. So everybody might get a dose based on their body, essentially. And then we sit together, we do some poems, we talk about, preparation, and then you get a shot in your arm typically, or your IV. And if it's the shot in the arm and it's the dive, there's typically about 2 minutes where you're sitting there going, is it working? I don't feel anything. Is it working?
Yeah.
And then you kind of feel yourself melt. And there's about 10 to 15 minutes where there's the launch period. So the heart rate and blood pressure do go up. To me, like the first time I did it, I felt like it was like I had these visuals of like stained glass church at night. With all these like purples and blues, and I felt like I was falling, like when you're falling asleep at night and you feel like you're falling, but I just kept through the floor, like another floor, another floor, another floor, another floor, and suddenly I was in outer space.
Wow.
And for some, the mind gets really quiet. For some, the mind gets really active. every once in a while, rarely, people are like, I don't feel anything.
No.
So every once in a while.
Interesting.
And there's about, after that 10 to 15 minute launch, there's typically about a 30-minute orbit period where people are kind of in it. The heart rate and the blood pressure come, kind of stabilize out, and people are kind of in their trip. And for some people, it's visuals. For some people, it's sounds. For some people, they go back to places where they've had trauma before. I've had one patient go back to a place where there had been kind of like a bike accident she was a part of in her childhood, where she was not hurt, but her best friend was. Mm-hmm. And she was able to kind of bring her wise mind to that experience and recognize, and tell her younger self that it was not her fault. I've had, say, my mom, I'm realizing my mom treated me this way, and I always thought it was my fault when I was little, that I wasn't worthy of love. But I can see now that didn't have anything to do with me. It was my mom's problem, not mine. I've had patients dive into a coral forest underwater and leave all of their pain at the surface of the water. So as an anesthetic, it can be really helpful for pain management as well. Kind of this psychotherapy piece. So there's this 30-minute orbit where whatever's going to happen happens. Sometimes people just go, wow. Sometimes people are, sometimes people cry or have big emotional kind of breakdowns. Yeah. So after that about 30-minute period, there's typically about a 10 to 15-minute docking period where people really feel like they're coming back to themselves, and they're kind of waking up, and they're kind of in the they're in the afterglow of that experience. And so within about an hour and a half, people are typically back to themselves. Every once in a while we get somebody who vomits, but it's typically very well tolerated, and we do medicate for that. And in terms of the cadence of treatments, it all depends on what people want. So for rites of passage, sometimes people just need one. Yeah. And then, maybe they need a touch up 3 to 4 months later. Sometimes we'll do weekly. If there's something that has been really hard, we might do weekly for 3 to 8 weeks. We might do one, and then a month later do another one, and then 6 months later do more. And then from our clinic, after a dive, you do an integration within 24 to 72 hours. And so that's a 50-minute follow-up, either with one of us or with a psychedelic savvy mental health therapist that you are already established with. Yeah. Talk about what is the meaning of this experience. And part of what ketamine does is it is a disassociative. So it allows us to separate from the patterns we've lived our whole lives. And so because of that, now we're not laminated to them anymore. And so now we can actually see them. You can actually see that mirror. And that's why we do it. There are so many things that we learn, patterns of living and perspectives that kept us alive and safe as children, and that we grow and bring those assumptions into our adult lives. It makes sense that mom and dad always fight. Mom and dad will always fight. When I'm an adult, I'll fight with my partner too. It makes sense that, I never get I never get enough love because I'm not worthy of it. And when I'm an adult, I'm not going to get enough love either, and I will still not be worthy of it. None of those things are true or necessary, but we bring those assumptions into our adult life. And ketamine gives us some space to look at how painful it was for us as a child to live in some of those situations, and really what heroes we are for surviving.
Yeah. One of the analogies that for me was really impactful, just being able to visualize it, was imagine these neural pathways in your brain are like paths in a carpet. I'm just going to walk on the same path in my carpet every day. And so you have this very clear path on the carpet. Yeah. And ketamine, in my understanding, is one of the only things that can get you off that carpet, find a new path that you've never been on in your brain, which is equally brilliant, but you've just never been able to see it.
Yep.
And so I thought that was such an interesting way of these pathways that we have, but we're so used to being on that same path that we just don't get off.
We don't. And we're just, part of it is safety. There's safety and familiarity. Yeah. Some can stay in shitty situations because we're comfortable, we're safe. Familiarity, new is hard. It's unpredictable. Yeah. And there is a physiologic correlation that happens with exactly that carpet analogy. That's so cool. I haven't heard that before. So thank you for that. Which is that ketamine actually releases something called brain-derived neurotrophic factor, BDNF. And that BDNF actually allows for greater synaptogenesis. So it's greater synapses being put together. It doesn't make new neurons, but allows the neurons that are there to connect in new and kind of exciting ways.
So me, I've told you, I'm like, okay, I'm ready to come up. I'm a little nervous.
Come on in.
A little nervous, but I don't know. So to that end, how can people get in touch with you, find you? You're in the state of
Yep.
Washington. Tell us how to, I mean, we will put all the information in, but I think it's important for people to hear from you.
Yeah, no, yeah, I'm happy to. So we are Neuroveda Health, neuro because of our neurology. It's how we perceive, process, and behave in the world. And it's not just our behavior, like I move my arm, but it's also cellular behavior. It's mitochondrial behavior. It's how we make our ATP and make our energy and process our hormones. So that's the neuro part. And then the Veda is for the Vedas, the traditional knowledge textbooks from, thousands of years ago in India. So Neuroveda Health, so NEUROVEDA health.com is our website. There is a connect button on there, just right on every page. It's connect. You can put in your information and we will get back to you. It is my personal vendetta that the medicine is accessible and responsive and like humane. So it's not like we're going to call you back in 6 weeks and tell you can have an appointment in 8 months. We really are responsive, and our front desk, I think, is just as critical as our providers in terms of being responsive to patient clients for whatever their needs are. That's how we do best in the world. So you can go to our website. I do have a podcast, Neuroveda podcast for complex health. I just recorded another episode this morning on plasmapheresis for environmental toxicity, which is really exciting. And so we've got, I think, 88 episodes, something like that, 87, 88 episodes published. And it's everything from, I really want to shout out Whitney Mack, who does an incredible show on she's a women's hormones, health, and fitness coach. And so her perspective is fantastic. But there's a bunch of shows there. So there's some free resources to kind of learn. We've got 5 providers in our clinic, and our nurses, we've got a great IV lounge. And so if you need some support for mitochondria, for energy, you can come in for that. We do have what we call an anti-aging. It's kind of a weird name for it, but it is NED and methylene blue. So we can talk more about how crazy that methylene blue is, but and the NAD. So and compared to a lot of other places, we're really reasonably priced for our IVs. And our IV lounge, we're right on Lake Union, so you can sit back in these huge comfy chairs. And we have one of those chairs that you get at the airport that will like massage you.
That's good.
Yeah. And you can look out at the water. And then we also have all of these Ayurvedic services. So if you've never had an Ayurvedic massage, it will blow your mind. In fact, the patient that I saw this morning for autonomic testing, so we do autonomic testing for POTS and dysautonomias, she said to me, the last time I was here, I got one of those Ayurvedic massages and it blew my mind. There is a way that you can feel safe in your body that so many women have never experienced. And our big process of Panchakarma, our big 3-week detox and cleanse, from which I recommend for every person every year of life, especially as we're aging, especially menopausal years. I once had a female patient with ALS, who, we're not going to treat that. And we can try, and sometimes I can slow it down with stem cells or plasmapheresis but it's a really tough disease to have. And she did a Panchakarma and she came back and said, never in my life have I felt so cared for. Like I actually feel more content now than I did before my ALS diagnosis.
That's beautiful.
So
it's so beautiful.
It's amazing. So I am proud of what we offer and how we offer it. And I am humbled by like the brilliance and the dedication and the humility of the clinicians and the staff that I work with. It is an incredible honor for me.
Well, we are so honored to have been speaking with you. And I think everything that you are doing and saying is just a yes and to so much of the information, education, and access to resources that women want and deserve. And so thank you for doing what you're doing and building what you've built, and so excited to have been speaking with you. So
and if you do sign up for our newsletter, we are going to be we just moved into a new space in March that has a classroom space. So we're just in the throes now of planning the classes that we're going to start for kind of this winter, the school year. So winter. So if you go ahead and sign up for the newsletter, then you'll get all the news. We're doing sound baths now at the clinic, which is pretty awesome. And we're going to do some holotropic breath work we have planned in September, but more to come on that. And we've been working on classes, especially for perimenopause, because God knows it.
Oh my God. Okay. Thank you Thank you. We're so grateful for you, and we will speak soon.
That sounds amazing. Thank you so much.
Okay. Talk
Talk
to
to
you
you
soon.
soon.
Bye.
Take care. Bye.